Good afternoon, everyone. This is Dr. Santos, and we're going to start our telemedicine project ECHO. So we have a very interesting topic today. It will be the use of drone technology in healthcare delivery. And we are fortunate to have Andrea Weitz. Dr. Weitz is from the Department of Emergency Medicine. And she will be discussing to us telemedicine project ECHO. We just have a little bit of a housekeeping to do prior to giving you Dr. Weitz. These are some helpful tips, and let's just make sure that your name is listed in the participant list. And if there's multiple people viewing at the same location, make sure you list the names, credentials, and email addresses of all those in the room in the chat. And there will be an appropriate credit. There will be a one credit, CME credit for participation in this talk. So Dr. Andrea Weitz is a globetrotter. She is originally from Seattle, Washington. She did her undergraduate degree in biology at City University of New York, magna cum laude. And she went transatlantic to finish her medicine at Trinity College in Dublin, Ireland with honors. Then she went back to the United States at University of Southern California to finish her master's in public health in global health with concentration in global health. She had many publications and presentation on drone technology. And also a brief trivia, she speaks Spanish, Japanese, French, and Serbian. So hola, konnichiwa, bonjour, and zdravo. I'll give you Dr. Andrea Weitz.
Well, thank you, Dr. Santos. That was very nice. Just bear with me for one moment, everyone. I just need to share my screen. If you just give me 1 second.
Dr. Santos, will you stop sharing your screen so that Dr. Weitz can? Thank you.
You're muted, Dr. Weitz, but you're
yes.
ready. Good to go.
Can everybody hear me? Wonderful. So sorry about that, everyone. Good afternoon. As Dr. Santos said, I'm Dr. Andrea Weitz, and I'm very pleased to be giving you all a talk today with our future on drones and healthcare delivery. For my disclosures, as we will move forward. Just 1 second, I apologize. I am a research fellow with Village Reach. It is an unpaid position, and I have no affiliation with all other drone companies that I am presenting here today. I am a co-founder of Drones RX with my business partner, Elizabeth Kissel. So briefly about me, I am currently one of the new emergency medicine residents starting here at Texas Tech in a couple days. My background includes some surgical training previously and a lot of global medicine, as you'll see from these pictures, particularly in Africa. I am currently a research fellow, as mentioned, at Village Reach, and we work on delivering healthcare with drones to those that live at the last mile in Africa. I've spent time in Liberia, Uganda, and Rwanda with this work. I earned my master's in public health in global health from the University of Southern California. And as I mentioned, I'm the co-founder of a new company called Drones RX, which combats pharmacy deserts and medication noncompliance via drone technology. I'm really happy to be here today and meet you all. So let's begin. So first, we'll cover these topics just quickly. We'll do a brief history of drones. We're going to do my brief history with drones. What in the world is a drone? uses of drones in healthcare, how drones apply to us here in West Texas and the United States, and then the future. So first, does anyone know what year the first drone was created in the US? And I realize we're not talking back and forth, but if anyone just wants to put in the chat, I'm just curious if anybody has any guesses. I'll give you a second. And believe it or not, and I can't see the answer, so I apologize, but it was back in 1918. And this was during the First World War when the US Navy commissioned Charles Kettering and Orville Wright to build a militarized unmanned aerial vehicle. Kettering was an electrical engineer and founder of the Dayton Engineering Laboratories Company and pioneered electrical ignition systems in cars. And Orville Wright, as a lot of us know, along with his brother Wilbur, created the first successful motor-operated plane back in 1903. When the US entered World War I, these two were asked to help the war effort and created the first self-flying torpedo known as the Kettering bug. This weighed 530 pounds, which included a 180-pound bomb, and was intended for precision attacks up to 75 miles away, which is way beyond what the military had in their arsenal at that time. The accuracy of this early drone was the result of an ingenious and surprisingly simple mechanism. After determining the wind speed, the direction, and the desired distance, operators calculated the number of engine revolutions needed to take the bug to its target. And then after the proper number of revolutions, the wings from the payload carrying fuselage or carrying the bomb itself simply fell onto the target. About 50 of these bugs were created, but none were actually used because the war ended before they were able to be, which is likely for the best. Throughout the 20th century, drones were slowly improved upon all over the world, but all for the war effort. From World War II to the Vietnam War, drones were created in every country. For example, this picture here of the Queen Bee is from the English military, and it was created in 1935. And this is where they believe that the word drone actually came from. So how did I get involved in all of this? Well, it was a series of very interesting steps and circumstances throughout my life. In 2018, exactly 100 years since the Kettering bug, I found myself in Monrovia, Liberia, working with the government at the time and a surgical colleague who lived there. We were trying to create an ATLS-like trauma training system. But while I was there, I noticed that there were very few ambulances and even fewer that actually functioned. And there's a picture of one of those ambulances up here. And you can see it's a little dirty. You can't really tell, but the tires are flat. It's a hollowed out. There isn't a whole lot going on here, and it's probably not going anywhere. And they all kind of looked like this. Then one night, when I was on call in the hospital, I had a woman come in after walking for 2 days while laboring with her first child. She was 19 years old. She had no mode of transportation. There were no systems in place for her to activate in order to get to the hospital. So she walked, as many women do in Africa, and she almost died, as a lot of women do in Africa. And while we performed an emergency C-section in order to save her and her baby, and after a few very tenuous minutes, she and her baby, which was named Andrea, was born, and they were both fine. Andrea is now a healthy 3-year-old girl running around the streets of Monrovia, hopefully safely. These experiences started to get me thinking about EMS systems and pre-hospital care and healthcare delivery in general, or lack thereof in a lot of cases, and how we as a society can do better. But it wasn't until I was in Uganda a year later, working with my colleague who's pictured here, Dr. Lucien, that I learned about the lack of blood access in Africa. There isn't really blood donation. Africans have a lot of preconceptions about donating blood in certain areas, and blood banks are lacking. But it was only when I went to the rudimentary blood bank at the hospital that I worked at in Masaka that I learned about Rwanda. And Rwanda was using a program using drones to deliver blood products across the country. My mind was blown. If they can deliver blood with drones and we can deliver many healthcare items with that same technology, why can't we do that? After that, I took a drone course at USC while I was earning my master's, and then I submitted an abstract to the EMSSA, which is an emergency medicine conference in South Africa. And it was there that I was invited to a podium presentation. At that point, I learned about a conference that was taking place in Rwanda for drones. And then I happened to go there afterwards to learn more about this. And that's me pictured at the bottom there next to a drone from a company called Zipline in Kigali, Rwanda. But let's talk about what a drone is. Drones are unmanned aerial vehicles. In other words, they're pilotless aircrafts. They're equipped with different state-of-the-art technology, such as infrared cameras, which are used often in consumer drones, GPS, which are used in commercial drones that we'll talk about later, and then laser, which is more for the military drones. They're controlled by remote ground control systems or a ground cockpit. The nose of the unmanned aerial vehicle is where all of the sensors and navigational systems are present. And then the rest of the body is full of drone technology systems, since there is no space required to accommodate humans. Aerial drones of today can be remotely controlled or launched in the air using various methods depending on their type. And I have some listed here on this busy chart. They can be hand thrown, catapulted, launched from pneumatic or rocket launchers, or even by conventional wheeled takeoff from a prepared runway. A lot of them today have vertical landing capabilities, what's known as VTOL. And as I mentioned, this chart, while busy, gives us an idea of the ranges for commercial drones. And you can see here that the longest range for a fixed wing, which is one that's actually either catapulted or takes off from a runway, is 160 kilometers. You have the multi-rotor, which has multiple rotors on it that that does lift and take off, does not require a runway. However, it only can go about 20 kilometers. And then you have the hybrid, which has both aspects, and that can go just a little bit longer. One thing that lacks on this chart, however, is the different types of energy sources. And they mentioned gas or electric in the variations column, but they also did not include the lithium batteries, which is most commonly used in Africa, as well as solar panels. So this is a picture of Singapore University, and they developed a solar-powered quadcopter drone back in 2018. This was constructed using lightweight carbon fiber material, and the quadcopter drone weighs only 2.6 kilograms, but yet has a surface area of about 4 square meters. It's fitted with 148 individually characterized silicon solar cells and supported by a frame equipped with 4 rotors. The solar-powered quadcopter drone can be controlled by remote control or programmed to fly autonomously using a GPS system incorporated into the aircraft. It can potentially be used as a flying solar panel, which provides emergency solar power to disaster areas, as well as for photography, small package delivery, surveillance, and inspection. But now that we know what a drone is, let's talk about their uses. That's the interesting part of this talk. And the first non-military drones that were used they were used for natural disasters and more for surveillance. They monitored the affected areas. And the first one we saw was back in 2010 during the earthquake that occurred in Haiti. 2012, they started to deliver small aid packages, and this was after the superstorm in Sandy in the northeastern part of the United States. And then in 2015, when we had that horrific earthquake in Nepal, drones were used again for surveillance. And you can see here on the picture on the bottom, that area that's circled in red is what drone was able to perceive. They could see the area of damage in order to send rescue teams much quicker. So aside from military and surveillance, why do we have drones, right? We have multiple forms of transportation, including cars, bikes, planes, helicopters, bodas, horses, etc. Why do we need to up the bar and introduce completely brand new technology? Well, the truth of the matter is in many parts of the world, these things are not adequate or available. In many countries, particularly in Africa, but also around the world, including the US, the roads are extremely poor. This picture on the upper left is a picture taken of a road in Madagascar, where there are mounds of dirt the size of small mountains. Getting a car through that is virtually impossible. The next picture on the top is taken in Nigeria, which has some of the worst roads and traffic in Africa. And you can see these potholes. In order to navigate around them, they have to get completely congested. And the car on the side actually blew a couple tires, as you can see. The picture on the bottom is one I took myself when I was in Uganda, and we're trying to travel from point A to point B, but we had a slight roadblock, as you can see. And cows and herders often will take precedence on the road, and therefore you just simply have to wait. There's also infrastructure which is severely lacking. Extreme weather, such as monsoons, create very dangerous conditions and often take out bridges, as you can see here. Often also, besides bridges, if there isn't, there's a man who has a raft who will literally take you across the river to get from point A to point B. However, that man sometimes works once a week or once a day or not at all, or the river is so strong that he is unable to work. So therefore you can't get from the place that you need to go. There are also very few technicians and mechanics. The cars often in Africa, which is where most of my experience is, they're very old, they break down a lot, there are no parts or people to fix them. This is a picture of my car in Uganda. I was traveling from 2 different hospitals, and little did we know that the car not only overheated when we started out on the trip, but also had a leak in its gas tank. So a 4-hour trip turned into a nightmare 9-hour trip because our car broke down no less than 7 times on our way back. And we had to depend on people driving on this very busy highway to stop and help us and either go pick up gas for us on their own motorcycles or a can of water in order to reduce the heat in our car. Severe weather, as I alluded to, they flood the roads, they make huge potholes, the trucks break down, they can no longer go farther, and there's no mechanics, as I mentioned, to help fix that. There are 2 seasons in Africa. This is about the weather, I apologize. The wet season, which is cooler, is very hard on the dirt roads. And these roads there become very pocked and complicated to navigate, wreaking havoc on the cars. Finally, you have extreme distance. And any place that can take 2 days can sometimes take 2 weeks to get to, depending on your mode of transportation. Traveling through Africa, while it's very beautiful, is very arduous. And a trip that can normally take, like I said, the 2 hours can take up to 12 or maybe even 2 days. It just depends what kind of situation is going. But also Africa is extremely spread out. And so you need quality roads and ways to get from point A to point B. All of these factors makes delivery of healthcare products extremely difficult and inefficient. Getting blood to someone who's having a postpartum hemorrhage is very time sensitive. But if the bridge is out, or the cattle have taken over the roads, or the truck breaks down in a crater-sized pothole, that blood isn't getting there, and that woman will die unnecessarily. So where do we go next? Well, quite literally, the sky. This is a picture of a drone created by a company called Swoop Arrow that flies over, it's flying over a very small village in Madagascar. And as you can see, the only thing in front of it is air. There are no roadblocks, no rivers, and hopefully no issues. Drones in healthcare is becoming a really important industry, which is why you're probably all here. The global medical drone market is expected to grow from $109 million US in 2019 to $641 million in US by 2027. This is at a compound annual growth rate of 24.8% during the forecast period of 2020 to 2027. Here's a short list of a lot of the known uses for drones in healthcare as we currently know it. Blood product transportation, lab samples and diagnostic testing, medication delivery, pre-hospital care, organ transplant, and also for the COVID and EBOLA fight. So first we'll talk about blood products. In Rwanda in 2016, a company called Zipline implemented drones to transport blood products to critical access hospitals in remote areas. The blood products are ordered via text message with signaled GPS for positioning, and blood is delivered within 30 minutes. They use a fixed wing style airplane that releases the cargo with a parachute that is biodegradable over the delivery zone. It can travel up to 160 kilometers and carry a 1.75 kilogram of cargo, or what we call a payload. A study testing the integrity of the blood demonstrated that blood units can maintain their integrity after drone delivery, including their pH and their temperature, and hemolysis was not inferior to that of being delivered by ground. And the major plus of all this is that the time it took to deliver these products was reduced dramatically. Similar initiatives have recently been started in Ghana. The president of Ghana launched the world's largest medical drone delivery service during an inaugural ceremony in the city of Omenako, which is also one of the 4 Zipline drone distribution centers in Ghana. This drone delivery service in Ghana operates 24 hours a day, 7 days a week. Each center is equipped with 30 drones and delivers to 2,500 facilities, which serves 12 million people across the country. Some of the treatments that Zipline provides to Ghanaians in remote areas are vaccines for polio, tetanus, and diphtheria. Health workers can place an order by text message, similar to the way in Rwanda, and they can receive delivery of these and other treatments by parachute, again, within 30 minutes. The newest country to take on blood delivery with drones is Sierra Leone. Sierra Leone has various health challenges, but one of the most unanimously regarded health challenge and regarded as a priority by the government is maternal mortality. Maternal mortality is estimated at 1,300 maternal deaths per 100,000 live births, one of the highest, if not the highest, maternal mortality rate in the world, as you can see from this graph here. Women in Sierra Leone have a 1 in 17 lifetime risk of dying due to pregnancy and childbirth. And maternal deaths account for 36% of all deaths among women aged 15 to 49. The under 5 mortality rate stands at 156 deaths per 1,000 births. And in addition, 54% of pregnant women and 80% of children are anemic. Therefore, blood products and oxytocin are imperative for this country's well-being and advancement. In collaboration with a range of experts and stakeholders, Crown Agents, a company that I worked with briefly, UNICEF, and the Directorate of Science and Technology Innovation, makes the case for a bridging solution to this problem. They integrate drones into the health supply chain in a very sustainable way to improve the access of these life-saving commodities for these women and children. Drones have the potential to provide access to 91% of Sierra Leone in under 75 minutes. And this all comes from a single central location on a drop and return basis. So the drone can drop the blood products and then return back for more. Recently, a drone corridor was created for this purpose in November of 2019, and a 5-year plan has been put into place. Aside from blood products, lab samples and diagnostic testing kits are also being employed by drones. Access to healthcare in Papua New Guinea is significantly limited by geographical and logistical challenges, and they also have a very high burden of tuberculosis there. There's an emerging epidemic currently of multi-drug resistant tuberculosis as well, and this is extremely problematic. Poor data collection and reporting procedures, along with very inadequate infection control, results in very low case detection rates. Furthermore, diagnosis is mainly clinical and only available centrally as a result. Therefore, Doctors Without Borders piloted the use of drones for a payload delivery of diagnostic samples between remote health centers and the central location, which is called Karima Hospital. The hospital has the only lab with functional microscopy and gene expert for diagnostic tools necessary to analyze the samples for TB. There are 6 health centers that range from 24 kilometers to 137 kilometers from that central location. And 3 of these centers are accessible only by boat, whereas the other 3 are occasionally accessible by plane and then walking. Therefore, with the use of drones, they were able to fly samples 42 kilometers in 55 minutes, as opposed to the 4 hours or not at all, depending on the roads and the rivers. In Malawi, UNICEF delivers HIV dry blood sample kits using drones, which allow for timely testing of infants who lived in rural areas. With timely testing, of course, you can get timely treatment. They were also one of the first countries to develop a drone corridor, which is an area that allows for collaborators from all over the world to build and test and document the use of drones for humanitarian aid. This was opened back in 2017. In Madagascar, the Pasteur Institute of Madagascar and Stony Brook University developed a project between 2016 and 2018 called DROTS, which stands for Drones Observed Therapy System in Remote Madagascar. This technology allows for drones to not only deliver tuberculosis samples to labs from remote areas in Madagascar, similar to the Papua New Guinea model, but also to allow for digital adherence of medication, has cough counters, and educational videos. With DROTS, medication is dispensed on a monthly basis, requiring a total of 7 round-trip flights for a full course of therapy. As with direct observed therapy, sputum smear microscopy is used as a surrogate marker for treatment adherence and efficacy at months 2, 5, and 6. Drones and medication delivery has become very interesting and a little more local. In Florida, UPS and CVS are flying their drones to the country's largest retirement community to fulfill prescription medicine with a company called Matternet. In 2019, Walgreens and Wing, which is a subsidiary of Alphabet, did begin a trial of drone delivery service for select residents in Christiansburg, Virginia. They offer a very interesting, convenient delivery service of some of the most sought after health and wellness items, food and beverage items, and convenience items. So for example, they supply these cold and flu packs for people. If they decide they want to text Walgreens and order one, it can be delivered. Or if you have kids that are hangry, they can offer snack packs. Another company in collaboration with Merck, a company called Volanzi, is piloting the delivery of cold chain medicines from Merck's Wilson, North Carolina Manufacturing Center to a health clinic in a remote area in North Carolina. There's 1.4 million people in North Carolina across 29 counties that have very poor access to healthcare. And so these flights in the project are hopeful to find the first drone delivery of temperature controlled medicines in North Carolina. This project uses an all-electric drone. So this is where the first time we're seeing electric drones capable of carrying 10 pounds and for a total distance of 50 miles. It has vertical and takeoff and landing capabilities, so it doesn't need a long runway to get there. And it also has this unique ability to deliver the cargo with what they call a soft touch of automated release once the drone has landed at the delivery location. In rural Virginia, NASA developed a drone-based delivery of medicines to pop-up clinics in order to reach what is known as the last mile delivery gap. And then across the ocean in Ghana, the UN Population Fund is a project in conjunction with the Gates Foundation that uses drones to supply rural women with contraceptives and medicines. And this cuts down transportation time of these medicines from 2 days to 30 minutes. And while a lot of these organizations advertise convenience, there are studies that are trying to fly drones with life-saving. A study proposed to be done in Conakry in the Republic of Guinea proposed a delivery of anti-epileptic drugs for both emergencies and non-urgent distribution. They would fly from the main hospital to a pre-identified gas stations, mosques, and pharmacies. They predict that their delivery time with drones versus ground transportation in this very congested city will be reduced by almost 80%. And the fastest time that they recorded to deliver these drugs was 15 minutes. Something that's really interesting with drones is pre-hospital care. In Sweden, which is a country made of many archipelagos and thousands of islands, they demonstrated the use of drones to deliver AED devices for people who are experiencing an out-of-hospital cardiac arrest, excuse me. In this study, it was shown that drones could arrive 19 minutes faster than an ambulance going to the same location. With this capability, the amount of deaths secondary to cardiac arrest could potentially be reduced dramatically. There was also a study conducted in Sweden that compared ground crew versus drones in locating drowning victims in order to initiate CPR in a more timely manner. It was found that drones could locate submerged patients faster than ground crew and calculated that at least 4 lives per year could be saved. In Israel, a company called Tactical Robotics is developing an autonomous medical evacuation drone that's designed to evacuate up to 2 wounded people at a time, or a 500-kilogram payload. I have a quick video to show this experimental idea. See if this will work. Here they're putting in the GPS coordinates to go to a predestined destination. See how fast it goes. And shortly you're going to see the precision of its landing mechanism. So clearly that's used for military purposes, but it's easy to be able to extrapolate how this could potentially be used for citizens in emergency situations. And then a company located here in the US called Hero, based out of Mississippi, uses telemedicine to assist in emergencies or mass casualties that occur. The company developed a really highly advanced, which is pictured here, a portable telemedical kit and support system that can be flown via drone to a layperson bystander once they call in for the emergency or mass casualty. And this can help people in a variety of situations. Not only does it fly this triage kit to the area of emergency, but it also connects them to a physician remotely. So the physician can walk the bystander through certain life-saving procedures before they get to the hospital. Remarkably, drones are being used for organ donation and transplant. In Baltimore, the first successful organ transport of a kidney was done via drone in 2019. It flew 3 miles over the city of Baltimore and was transplanted into the recipient without any histological evidence of tissue degradation. In fact, 30 days out from the transplant, the patient was doing really, really well. And the time it took to fly over the city was 9 minutes and 52 seconds. It was the first drone to be approved to fly in Bravo airspace. and it was flown within the line of sight, which does limit its distance traveled. But this does demonstrate that this type of technology is in fact possible and successful. Drones are also being deployed to combat everyone's favorite pandemic, COVID. And Village Reach is currently working in the Democratic Republic of Congo at the moment, as well as Central African Republic, to begin this project. And there'll be more about this as this project takes place. Most recently, I applied for a grant with Village Reach to implement drones to combat Ebola in DRC. I don't know how many of you know, but DRC is currently battling, I believe it's 14th epidemic of Ebola in the last few years. And so our project aims to prevent the spread of Ebola in at-risk provinces around the currently affected health zones. This is occurring in Equator province in the DRC. The current case fatality rate for this particular strain is 41.4%. So our aim is to accelerate preparedness interventions at healthcare facilities and communities. The preparedness activities will focus on pre-positioning of drones for lab transportation back and forth, program monitoring, and operational support. The project will help reduce the incidence and prevalence of Ebola, we hope, saving countless lives. So how do all these projects get implemented? Do you just go into a country with your drone and say, hey, I have an idea? No, it takes time, it takes money, it takes a lot of negotiation with different governmental agencies, and it takes community acceptance. The Village Reach model starts out with various phases, as you can see here. The first, identifying the problem and the need. Then we employ a rapid readiness assessment tool, which is something that I helped design, to determine if the country is actually ready or not for such an undertaking. We look at factors such as stakeholder willingness, the current health supply chain within that country, in-country regulations, whether they have drone regulations or not, in a lot of cases they don't, technological capabilities, infrastructure, and human resources, including community sensitization. Once it's determined that this type of project is feasible in that country, then we start with phase 0, which we do a technology demonstration of the drone. We get civil aviation involved, the Ministry of Health, Ministry of Transport, all the ministries. And then we go to phase 1 and then phase 2, et cetera. Most phases are currently in phase 1 and 2 right now. But I can't emphasize enough how important it is during that rapid readiness assessment component to get community sensitization really set up well. We published a paper last year, actually, called Insights Before Flights, How Community Perceptions Can Make or Break Drone Medical Deliveries. And we concluded, we looked at 4 different countries, 4 different communities in the DRC, Mozambique, Malawi, and the Dominican Republic. And we wanted to look at the community's perceptions and knowledge of drones in healthcare. And we concluded that the extent to which a community understands and supports the use of drones to transport health products will ultimately play a very critical role in success or failure of the drone's ability to bring life-saving products to those who need them. This is really important because there have been multiple situations, particularly in the DRC actually, where when the community was not fully sensitized and the drone program completely failed. They often will consider drones as part of the rebel activity that takes place with all these different civil wars that occur there. And they think that the rebels are actually flying the drones in order to target the communities instead of actually using drones for humanitarian efforts. So it's extremely important to be able to explain to the communities what we're using the drones for. But all that talk is over there, right? We have roads here in this country, we have infrastructure, we have single tall vanilla lattes at Starbucks on every corner. So why do we need drones? Well, because while all that may be true, we also have our fair share of healthcare disparities here in West Texas and the United States. The list is long and beyond the scope of this presentation, but I would like to address one of them here in West Texas. Currently, we have over 500,000 people who live in what is known as a pharmacy desert. For those of you who are not familiar with this term, a pharmacy desert is an urban area where people can't fill a prescription within a half mile of their home. This is a low-income population with no car, or a mile for others. In rural areas, the radius is 10 miles. Oops. There are 150 counties in West Texas where there are no pharmacies, and 4.8 million people in Texas who live in a county with only one pharmacy. So why is this an issue? Because medication noncompliance is a major concern in healthcare, and part of that noncompliance is due to difficulty in accessing prescribed medications. Approximately 35% of patients discharged from the ER do not pick up their medications, including high urgency ones like antibiotics that they might need or heart medications. And for those that do, over 50% of the 2 billion prescriptions each year are not taken correctly. That's 1 billion each year that are not taken correctly. This leads to not only unnecessary hospital admissions, up to 10%, in fact, for noncompliance, but also exacerbations of chronic illnesses that could normally be managed at home. So not only are people getting sick and even dying, but our healthcare system is being taxed, $300 billion annually. To alleviate this, what if we had a drone service that not only was able to fly medications door to door from hospital to home, but also to be accompanied by a telemedicine consult with a pharmacist or a doctor? Drones RX is a company that I co-founded, and we are hoping to decrease the size of pharmacy deserts, medication noncompliance, and ultimately chronic disease exacerbations. We want to decrease unnecessary ER admissions, as well as poor patient outcomes. Overall, we want to try and save lives using drones. And while we're at the very beginning stages of this endeavor, I say stay tuned to watch that. However, with new technology, there will always going to be roadblocks and limitations. Drones are no exception. While there are many, a few big ones are listed here. One is the consistent framework and regulations is lacking around the world. Drones are becoming more commonplace, fortunately, so more regulations are being put in place and countries are publishing their own guidelines more frequently, but this is still a big source of contention for a lot of drone manufacturers. Shared airspace is an obstacle that has been worked out with the FAA as well as Civil Aviation Authority across the pond. Drone corridors are being built with greater frequency, which is useful to be able to test and collaborate on drone technology. And in fact, New York just finished building a 50-mile drone corridor across the state. In Baltimore, as I mentioned previously, that hospital received approval to fly their drone across the city in Bravo airspace. So things are being worked out. Safety and privacy are another concern. Safety in terms of proving that drones are, one, safe, they're not going to crash into a building, which is important, and also that they won't fall out of the sky, which unfortunately does happen, albeit very rarely. But nothing is foolproof. And as I said, there are instances where this can occur. Privacy is another issue, particularly with patient medical records and information. So we'll need to have another framework in order to work that part out. Operating beyond visual line of sight, which is BVLOS, is something that's becoming more popular and very slowly more accepted. In fact, a company called American Robotics, which is a company based out of the US, given its name, was just approved to fly drones beyond visual line of sight by the FAA back in March. Finally, the power source. Batteries are the most commonly used power source because they are often the least expensive, but they also require charging. Therefore, this limits drone distances and increases the time of the deliveries. If you have to stop and recharge and charge your battery for an hour and then continue your flight, this is time inefficient. Other energy sources such as electric, gas, and solar, as I mentioned earlier, are used, but a little less frequently. And this is a source of research as we speak. However, limitations are only limits if we make them that way, and in them are often hidden opportunities for innovation. Despite the obstacles, drones offer a wealth of potential for many life-saving interventions, from delivering blood and oxytocin for postpartum hemorrhage to diagnostic testing for EBOLA, from an AED, from an out-of-hospital cardiac arrest, to making sure that someone is taking her insulin correctly so they can avoid DKA or worse, hypoglycemia, and avoid a hospital admission or even death. The sky really is the limit here, so we should aim high. A friend of mine once said that imagination is more important than knowledge. Knowledge is limited. Imagination encircles the world, much like a drone. So I want us to be inspired, okay? I want us to maybe be creative with our healthcare and make it what we dream that it can be, but of course by using drones. Thank you very much for your time. I'm very happy to provide references upon request and any reading material anybody might be interested in. Thank you.
Thank you very much, Dr. Whites, for this excellent presentation. My mind is blown right now, and my mind is kind of racing on the different possible utility of drone technology. I would say in trauma, in pandemics, in emergency medicine, organ transplantation. There's somebody here. I think Jessica is here, who's from the organ transplantation group. Deliver of medication. One of my my hope is, after doing a telemedicine visit, and my doctor will give me a diagnostic test. This diagnostic test, without me leaving my home or my house, will be delivered, by a drone. Then the result will be shown, and my medication will be delivered to, by my nearest pharmacy, using drone technology. I think that will be the future.
Correct.
Of course, my mind is racing too. There might be a lot of potential pitfalls and potential, complications and issues. Of course, in the organ transplantation group, they will say, "Is it this safe? We have a precious cargo in there. We don't want it to be, to be falling down the sky. Is there a regulation who will be doing this? What's the environmental effect, on the birds and the environment on this?" And piracy, I'm thinking about drug trafficking and whatnot. So I have a million questions. So could you kindly enlighten me on, is it safe? What are the regulations? What are the things we need to do? Is this possible even?
Well, and it is, and of course, those are very good questions. And this is a new technology. This has been, new in the sense of technology. So about 6 years, I would say, that really we've gotten a lot of steam on it. And there are a lot of regulations to be worked out. We really do need to get the FAA involved. But as I mentioned with that study in Baltimore, and this was the first, and I believe the only one that's actually happened, they were allowed permission to fly in Bravo airspace. And within that study, so some questions that they had to answer was, one, they had to do it at a very particular time of day. So they had to do it, I believe, from 12 p.m. to 6 a.m. So it was where less traffic was. They also had to make sure that their hazardous waste materials weren't going to be an issue. But because it was packaged in a very particular way, they were able to account for that and make that safe. Of course, there's always the chance that a drone will fall out of the sky. We work very hard for that not to happen, but you have the same chance for an ambulance to get into a car accident. Or, what's worse, I don't know how many of you remember that flight, I believe from Minnesota, the transplant team that got into that horrible plane crash and lost 6 lives, as well as the organ. So, that's probably worse, honestly, than losing an organ by itself. So there are a lot of questions, but with drone corridors and very specified airspace that we certainly can build in this country, we can avoid a lot of those situations. With the birds, that's definitely the environmental risks. That's definitely something to think about. Again, drones, especially if they're electric or if they're worked on solar power, you're avoiding a lot of the pollution that a lot of cars and planes put into the air. You'd have to worry about migration patterns with birds, and that's something that you could work with the environmental agencies with. Those are all really good questions, though. I hope I answered some of them.
Well, thank you for answering those questions. Any questions, from the group? If you want to directly ask the questions, you could just unmute yourself and ask Dr. Weitz. Dr. Weitz, I have a question from a trauma surgeon. In your experience, are you aware or do you see any role of drones in delivering of blood products to trauma centers in field of civilian trauma, in trauma sites, I guess?
Yes, and I think that would be a very, very good use for drones, actually. If you have, this could be both in rural settings where someone is in a car accident and a bystander comes by. One, they could let the hospital know there is an emergency here. They could send an EMS as well as a drone with some blood. But also even EMS systems, say they have a trauma with a very long extrication for that patient. And if they could send a text message to the hospital that's set up for this, they can have blood delivered within, 10, maybe 5, 10, 15 minutes, depending on their location. And then the EMS crew can start blood if needed, if that's what was needed to happen. So absolutely, I think that would be an incredible use for drones.
And this could be, aside from blood products, there are some medications,
Absolutely.
like your, PCC, TXA, right, all those life-saving medications.
Exactly.
How about, drug trafficking? Can this potentially be, a venue for drug trafficking as well as piracy? Sometimes my package gets stolen in my front yard. So,
Well, so yes, of course, all of these things are possible. Drug trafficking has not been anything that I've actually ever encountered so far, at least with my experience with drones. I certainly have seen drones being shot down by some rebel groups in varying countries in Africa. So that was something to think about. But that's why you have the importance of the community sensitization. Obviously, drug traffickers probably aren't going to care, about the community sensitization projects. But that is an issue. In regards to getting your package stolen, one thing that a lot of drones are employing now are security systems. So there will be a code sent between whoever's ordering the drone service and the drone company, and they text a code to you, and that code has to be put into the drone in order to release the medications. So it's not completely foolproof. Of course, someone could steal the drone and bash it open, I suppose, is possible. But it is one, at least, step that we can take to make it safer.
I think that's a great idea, even having a camera on so you will know who's
Exactly.
consuming your product.
And it could be live streamed too. So
yes. So there's a question here from from Rohan Tensi. Dr. White, could drones be used for remote medical monitoring of communities by physicians that are far from major hospitals or extremely rural?
yes, and that is something that I really want to start employing here. And that's a lot of that also was taking place in Papua New Guinea, Madagascar, with the TB and the drug monitoring and the compliance issues. But I think we could absolutely use drones to send a camera to that person's home or that community center or what have you, whatever the community decide they wanted to do. And you could do monitoring with that. You could do a telemedical visit. You could even you could send medications over if they were running out of the medications. But this would be a really excellent way for major hospitals to be in touch with their rural patients. Patients don't often want to take a 4-hour drive to come to the hospital for their clinic visit. That's the last thing they want to do. They have to take a day off of work. They have to find a babysitter for the kids. It's not so simple. But if we could send something to them that takes 30 minutes to get there, then they could have that consult with the physician or the hospital to follow up on their medical care.
I just like to piggyback on that, for those who are not aware, in Africa and third world countries, directly observed therapy, meaning the doctors or the nurses seeing you taking those medication is
Correct.
the number 1 ways of eliminating TB on those countries. And
Yep.
so this is what Dr. White is kind of mentioning. And
Yeah. Thank you.
by the way, I have a friend in CDC who are very, who have a project about directly observed therapy, and I'll give you the number later on today. Probably you could collaborate about this project.
Yes, I'd love to.
And it's not just in rural areas, Dr.
Right.
White. I think in urban areas where the traffic is horrible, in my country, in the Manila, Philippines, is one of the most horrible traffic in the world. And sometimes medications will be delayed because of traffic.
Exactly. And that happens in many, many countries around the world, but including here as well. And you go to Los Angeles and the traffic is horrific. And not only that, but you have areas too in this country that pharmacies don't exist in urban areas. So in Los Angeles, there is a 30% of the population in Los Angeles live in pharmacy deserts. And this is a very urbanized area. This is in one of the richest cities in the world. But for them, that's not the city that they live in. So something to consider.
I am surprised by your data saying that how many counties are there in Texas with no pharmacy at all?
150.
Wow.
Yeah.
I think Laura Lab had a question.
Yes.
Laura?
As a matter of fact, in about the early 2010s, we had a relationship with Presidio, Texas, and we were apprised that there was no pharmacy within Presidio, and the choices for the citizens there were to cross the border with a script or to drive an hour north to Alpine. The problem with that was if you had to pass a border check, and if anyone in the car was illegal, the entire vehicle got turned around. And so, imagine outfitting Alpine with a drone system and being able to rectify that. Presidio may have gotten a pharmacy by now, but, that's a very good case in point where, just literally delivering meds is a huge service to the community.
Huge service. And it has such high knock-on effects of medication compliance and
Yes.
exacerbations of your asthma or your diabetes or your hypertension or what have you that make people come to the emergency room. It's extremely important.
Well, the other thing, Joe, is I'm very, concerned about sometimes how we manage our resources, how much wastage we have,
Right.
especially living here in the United States, we throw a lot of things because they are expired. Prior to expiration, I think we should have this networking of, pharmacies wherein, hey, I have a medication about to expire. Probably you could, use this rather than,
Right.
having those into waste. Same with blood products, I would say.
Absolutely, absolutely, no question.
All right.
Santos, can you imagine one day with the HSC with a landing pad for drones out front and the helicopter pad out back?
Yep,
I'm about to say that is not remote, that eventually we will have a dedicated drone landing pad.
We're on it.
absolutely.
And the drone from Israel, that is kind of exciting. You know, it carries person, right?
Yes, yes, exactly. And it is exciting. I mean, granted, that video obviously was for the military, but it does show what is possible. And the drones, I think a lot of us think of drones, we think of these small little things that we play video games with and they fly through the air. And yes, I mean, essentially that is what they are, but they can be enormous as you saw. And I mean, I know someone who's developed drones, I think he's based out of Germany, who for just that exact reason, to actually lift passengers, lift people without a pilot on board. And so it's a little bit safer. Again, it's fewer lives that could be at stake, potentially, if we're going to think of it that way. But they also just have this capability. I mean, you saw the maneuverability of that drone as well. And it was so precise. And it's incredible.
Yes, it's just like Rise Up the Machine. I mean, it's just like Terminator. Even the music sounds like Terminator. So
I know. That was my favorite part, was the music.
however, I think we need a bigger drones because America is getting bigger.
Exactly.
So we need a bigger capacity, more than a ton.
That's true. That's probably true, especially if we want 2 passengers.
Absolutely.
A few more things in chat, Dr. Santos.
All right. James, Andrew, do you have any question?
Yes, how would you foresee, like in larger cities, to minimize multiple drones being in the air used for emergency purposes and other services that are being delivered at some point? Before, when I was growing up, there were, when you dialed for an emergency, about 6 or 8 different ambulance services showed up at the scene, for one thing. And just the crowding of the airspace, I think, is a potential issue. Would you see this kind of in the hands of EMS primarily, that would allow for a more coordinated effort in delivering things or people or whatever?
I think that's an excellent question. And I think EMS would certainly play a role in it, but also the Federal Aviation Authority would have to play a role in it. Having a dedicated airspace would potentially be how we would have to do that. But similar to ambulances too, I mean, I believe a lot of ambulances now have a certain area that they will respond to. And I think we could set that up with drones. That one example that I gave in Ghana with Zipline, and they have 30 different drones that go to very specific areas for the blood products, and they serve about 2,500 different facilities. And I think if we're able to zone off different areas where drones could be, depending on where that emergency is, we could actually control that pretty well.
Yeah.
Dr. Weiss, there's a question from Charles Zhu. Do you think West Texas community will have trouble accepting these drones?
I think that, again, we would have to do some big community sensitization for that. I know that there would be people who would be concerned with having their medications delivered via drone, that perhaps they were having an alien encounter, which I say that with kind of tongue in cheek, but it's actually not. So I think it would be something that we'd have to do a lot of publicity for, something we'd have to go physically out to the communities and show them a demonstration, just like we do in Africa, the same idea. And I think the advantage that we have here is we do have social media, and so that will help. But really, it's going out and meeting the people and making sure that the community is in fact ready for that. I think if we implement it without doing that, it's going to fail.
All right. And Laura Rowell had a question. Do you have an idea of when the use of drones for medical reasons discussed may be able to be employed in the US?
When drones for medical reasons to be employed in the US, used in the US? Yes. I mean, I think now they actually are. The most recent or the oldest data that I have in the US is 2019. So that's a couple of years. 2020, as we all know, kind of disappeared into the ether. But 2019 is when things started to happen. That's when that organ transplant occurred. And that's when a lot of those drug deliveries in Virginia and North Carolina have started as well. So I think it is slowly being utilized. but I think that a lot of us haven't heard about this quite yet because it's still very much a work in progress.
All right. Any other question from the group? This is excellent. I'm actually excited, and please count me in this project.
Yes.
I am very excited about this. I think James, have another question.
Yes,
Yeah.
please.
What did you envision for your particular company, Drone RX? What is the goal for that again?
Yeah, so the goal for us is we want to try and eliminate the pharmacy deserts, so things where people, like what Laura just previously brought up about that community down on the border. And so our idea is to be able to have an app that is on a phone that people can actually use to order whatever medication they may have, and they can actually set up a monthly delivery system. Not only that, once the drone flies there, the drone is equipped with a camera that is able to do telemedical consults, either with the pharmacist, depending on the medication, or the doctor. And if the patient wants to choose to talk to a doctor, then there'll be a doctor actually available to do that. And so it's really like it's a consult service that actually delivers the medications on a timely manner.
Great.
All right. If there's no other question, thank you very much, Dr. Whites, for that amazing presentation. And we're presenting you this challenge coin as a token of our appreciation for your wonderful talk. And don't forget to do the evaluation that Laura will be sending you all after this presentation. And also for next month, we will have Dr. Amy Batt, the Director of Cardiology Outpatient Services of Massachusetts General Hospital, an associate professor of Harvard Medical School, to give a talk on optimization of telemedicine in your institution.
Excellent. Well, thank you, everyone. Thank you very much. I appreciate your time and attention.
All right. Thank you very much, Dr. White. All right. And good luck for next for the start of your residency.
Thank you.